of if it's to transition from a nursing home back home. We've helped people that have home health, where nurses will visit them where they're at. And we've come across a lot of the situations that people are in. Not only is it a healthcare side that we help with, but it's also the financial. It's a financial strain on a family if somebody has to take time off work to take care of a loved one. But there are resources that are available that make it more affordable to take care of someone at home. And it's covered by, government programs, Medi-Cal insurance. It's a matter of applying for those different types of programs. So that's the scope of what we'll go over for the first 20 minutes, is to share about how it can be more affordable for caregivers and for seniors as they're being taken care of at home. And we can also hear directly from home health service about what options are available. Someone can have home health at home. It's covered by Medicare, which people get as they turn over 65 years old. We also have question and answer at the end, so please feel free, just anything you all can think of, and we're glad to answer any questions. Without further ado, our last call for pizza, you all can have just at any time. We have drinks as well, so we'll go ahead and get started. And we have here on screen, it is our resource list. For one of the flyers that was in each of the seats here today, it shows the agenda that we have for the event. And the link for our website, which is redwoodbakersfield.com, is listed on this flyer. This same list of resources is on this flyer. You all can apply directly for any of these programs at any time. It's free for anyone to apply for. If you all would like to follow along as we go through this material, it's just a matter of, even on your phone, if you look up redwoodbakersfield.com, and it's the resource tab, and it will show up the Kern County resources. So these are the different things that we'll go over here for the first 20 minutes. On the back of this sheet of paper, it shows the financial benefits. So it is a lot of money that people can receive just by applying for the programs that are available. It's something that I see some members of the audience, they're wearing scrubs. So for someone who's in the healthcare field, if they're taking care of family at home, these programs are very applicable for helping to make ends meet. It just shows it's a certain dollar amount for each one of these programs that is the financial benefit. So just starting with the first resource here that's very common that we've helped people to apply for, which is especially relevant because one of the hot topics is about food stamps. There's the insecurity about whether food stamps will continue this upcoming month. So I just share through Community Action Partnership, this is a program that many people use. It shows here the Senior Food Box Program, and by applying for it, it's 30 pounds of free food that someone can pick up each month. And we've met with people that are living at home. There's a family member that's taking care of them, and they get Social Security only, which is about $1,000 to $1,500 a month. So if they can save $400 on food each month, it's a big deal. It's a lot of money that they're able to keep in their pocket. So it's 30 pounds of food they're able to pick up from any of these distribution sites. And with Cap K, it's throughout Kern County. One of the barriers is to apply for this program. It's to submit certain paperwork. It asks for their proof of address, for their ID. It's a certain process. But once someone is on this program, they can pick it up from anywhere around Kern County. So it's something that we've seen a lot of people they benefit from. In addition to the Cap K program, there is Project Food Box, which instead of having to pick up the food from a distribution center, Project Food Box delivers right to where someone's living. So if transportation's an issue, which for a lot of people it is, to maintain a vehicle and just for gas and the availability of a driver. It's all those barriers for picking up food through this program. Project Food Box, it will deliver right to someone's home for free. And through home health service, which we'll share about here today, we can have a social worker that will come to someone's home to help them apply for these kind of programs to make it more affordable to live at home. Before we continue down this list, just as sharing here locally, in preparation for giving this presentation, we had looked here locally. It shows this is the Postal Service website. So it shows the amount of people that are over a certain age in any given area. So we were just curious to see senior housing with home health. It's normally for people that are over 65 years old. So we had looked to see what percentage of people here locally are over 65 years old. And I wonder from the audience, would anyone like to make a guess at out of 100 people, how many are over 65 years old here locally, in East Bakersfield?
40%.
So as 40% as one of the guesses. And it just shows here on screen, it's for this area. It shows, and if you get an extra, it's pizza to go for getting the right answer, but it just shows it's 48% of people here locally are over 65 years old. If we look at just other areas, it says 56%, 48, 60%. It's showing, I know the text is small, 60% of people are over 65 years old. And the average household income, it shows as well, it shows $30,000, $40,000, $50,000. So within that range is the average household income. On the back of this sheet, all of these benefits that I'm going over today, the financial benefit of someone applying and receiving all of these, it's about $30,000. So for a house that's making $50,000, it's a 60% raise. It's just a matter of applying for it and receiving the benefit that's out there. And once again, what would be the barrier that is otherwise why someone has not applied for this just yet? And I think it's just awareness. Perhaps people just don't know, they haven't been presented this information in this way. They can put all these programs together and it makes living at home that much more affordable. Just as the next item that's on this list, with incontinence supplies, which perhaps it's a taboo topic, and we have with training and assisted living, it's our potty talk that we have. But incontinence supplies is a big problem that a lot of people, they have to contend with. And for a family that has to pay for it out of pocket, if someone were to buy briefs or these adult garments from the pharmacy, it's at least $300 a month. Through Medi-Cal insurance, it's covered financially. If someone goes to their doctor and says, I'm incontinent and I wear size medium, they will then write an order for, if it's 3 times a day for a month, that's 90 briefs that are delivered to the person's house. And it's at least $300 of benefit. We talk with families that take care of, if it's a grandmother, a grandfather at home, and they're paying out of pocket for the chucks, for wipes, for gloves, and these kind of briefs. So it saves at least $300 for people that are taking care of a loved one at home. With transportation as well, it is a benefit that's covered by Medi-Cal insurance. So it just shows, once again, here on our list, if we go to transportation, through the Medi-Cal website, and the majority of people that have Medi-Cal insurance, it's about 70% in Kern County. This is the managed Medi-Cal plan that they have. It's Kern Family Healthcare. It's, once again, it's just not a very widespread knowledge that it's transportation's covered by their Medi-Cal. It says, do you need a ride to your medical appointment? And it's a matter of submitting a certain form completed by the doctor. It says this person, perhaps they use a walker, chair, or if they're on oxygen, their doctor can fill out what is called the PCS form. And once again, we have social workers that can help people to apply for these programs, and we've helped hundreds of people to apply for them over the years. And it will cover the cost for someone to go back and forth to a doctor visit. So instead, spending gas or even the availability of a driver, this makes it that much easier to see a doctor, to receive these kind of benefits. A lot of these programs are based on Medi-Cal insurance. And Medi-Cal is primarily if someone makes less than $2,000 a month. And people we've talked to, perhaps they've applied for Medi-Cal before, and they've otherwise been discouraged because it was denied in the past. They have changed the requirements on who is eligible. So if someone's been denied for Medi-Cal in the past, there are services that can help them qualify for it. It says eligibility happens here. And a common phone call that we'll get, because assisted living is covered by Medi-Cal insurance as well. So someone can stay here and it's covered entirely by their insurance and Social Security. And if someone otherwise doesn't have Medi-Cal, perhaps their income is just over the benchmark, which is common. So say they have $2,200 of Social Security they get each month. To get Medi-Cal with no share of cost, it's $2,000 is the benchmark. So if they get dental insurance or something to reduce their discretionary income below $2,000, they then can qualify for Medi-Cal. So it's just another way we've helped people to get connected with these kind of programs when otherwise they thought that they wouldn't be able to. It's categorized. Each of these categories, it's something different that people can qualify for, and it's this kind of financial assistance. With the utilities, especially now that seasons are changing, it's colder at night, and through CapK, they have free weatherization. Cut your energy use and reduce your future utility bills with free weatherization service. If it's weather stripping, it's more energy efficient appliances are available through CapK. It's just a matter, once again, of submitting the paperwork. It says what documents are required to apply for weatherization. There's certain forms to fill out. In many families that we talk to, they're at work during the day. They don't have perhaps the time to fill out this kind of paperwork. And that's where we come in. We have a social worker that can sit down with someone and they can walk them through how to apply for these programs for free through home health service. So once you add these things together, it's a big amount of money that it becomes. Even if someone is past due on a utility bill, we received a phone call from someone and they said that they needed a place to live. They were past due on their PG&E bill. They were at risk of getting their electric shut off. So we told them we can have someone to come out to help them apply for the REACH program because it will waive up to $500 of past money that's due. And it's just a matter of submitting the paperwork, of someone being able to qualify for these kind of programs. If it's with the different types of utility, even with internet, it's these kind of things. In the spirit of all of these programs, it's to help people to age in place, to make it more affordable, because many times the reason that someone has to move to assisted living or to a nursing home, it's a financial problem. They can't afford to live at home. The cost of housing is higher, the cost of utilities, the cost of groceries. And if someone's getting Social Security, which is $1,500 a month, how can you make do? And it's the reality over 50% of people live with. And it's just the awareness of these kind of programs is what we're promoting. On the topic of with housing, and this is applicable for people of any age, BCC DC has different home buyer programs. So if someone is interested in buying a house in Bakersfield, regardless of their age, if somebody's working or if they're retired, they have these workshops. It's usually once a year. They have one coming up in November, and it shares its down payment assistance. So if somebody uses, one of the most common ways they'll buy a house is through an FHA loan, which is for first-time home buyer. The down payment for a first-time home buyer loan is 3.5%. So if someone's buying a house for $400,000 in Bakersfield, the down payment is about $15,000. VCC DC will give someone a second loan to cover the down payment. So they can buy a house for no money down. Even if it's in rural areas, there's a program called USDA loan. If it's in Wasco or Delano or Taft or McFarland or Lake Isabella, it's 100% financing. So there's no down payment required to buy a house. And by talking with them, there are situations, depending on the price and depending on someone's credit score, they can buy a house and the monthly cost is less than renting. So it's something just to make it that much more affordable to get by. And the affordability, it's the big topic that we will normally address. If someone's looking for assisted living, they can't afford private pay facility. Private pay assisted living starts at least $4,000 a month. So right now we're physically in one of our facilities, it's covered by Medicare. Someone can live here and it doesn't cost family anything monthly. It's covered entirely by their Social Security and their Medicare insurance. It's in contrast to private pay assisted living, such as Brookdale or Magnolia Place or Ivy Park or the Palms of San Loren or just local options here. It's at least $4,000 a month for private pay assisted living. So if someone's making $1,500 of Social Security, that means their family has to come out of pocket $2,500 a month at least to cover the cost. But if the average household income is $40,000 or $50,000, how do people do it? And the reality is only 13% of Americans can afford private pay assisted living. The other 87%, it's primarily funded through Medicaid insurance. But for some reason, it's just not as widely spread, how to be admitted to this kind of facility. And the way is, under this assisted living waiver program, and we are one of many providers. Over the last 4 or 5 years, many facilities have begun to accept this program in Bakersfield, where it's covered entirely by someone's Medi-Cal and Social Security. It doesn't cost anything from family. The wait list throughout the state for this program is currently 2 to 3 years for someone to move. So if somebody comes and they say, I'd like to set an appointment for mom or dad to move into a facility, usually they want it to be yesterday. They want a fast solution. But the reality is that there's a wait list for this kind of program throughout the state. The main way that people that are living at home with family can become approved is if there's a letter from Adult Protective Services. So if there is some sort of issue, if their utilities are being turned off, if there's some risk of not being able to take care of themselves, they can't afford otherwise private pay options. We had someone that had walked just to our facility and they requested a tour here last week, and they said that their mother was living with her family and they had dementia. So she was, during the day, walking out of the house because she could open the door and she was forgetful. So she would, just wander down the street. It's a big risk. So they would end up having to call the police to bring her back. And this was an ongoing issue as her dementia had progressed. And we had shared with her, in that kind of situation, Adult Protective Services can intervene to share what options are available. One of which is assisted living under the Medi-Cal waiver program at no cost to the family. Because otherwise, they were daunted. They heard $6,000 for private pay assisted living. It's just not financially feasible. So that had been the solution. That's what we recommended for them to do, is to contact Adult Protective Services, because this person's at risk of harming themselves. They're eloping out of the house because of their dementia. So there are options. There are programs available. If it's someone to buy their first house through VCC DC, they have a presentation coming up in November. Their phone number is listed on this resource list. This flyer is included. And if they're looking for assisted living, we can talk with them just anytime. We have people that are on the phone. We can meet in person as well to walk them through this process. And one of the big benefits that is available, it is home health service. And it just shows here the different types of services that are available for someone that's living at home. If someone, one of the biggest things that we hear about is they want physical therapy. Someone at home has fallen, perhaps they use a walker or a wheelchair. They would like to get back up to their baseline, so that physical therapists can visit someone for free. If they're over 65, it's likely they have Medicare insurance, and that covers the cost 100%. Nurses can come out to do wellness checks. We can have food delivered to their home. All of these utility assistants, it's all of these kind of social services that we help to bring into place. The goal is for people to remain as healthy as possible at home, as opposed to if someone were to fall at home, they go to the hospital, or if they go to a nursing home. Most people want to live in their home. It's their familiar environment, and home health is a big part of what makes it feasible. We have a social worker that can help them apply for all these things. So on one hand, I've gone over the financial part. These are the programs that are available for anybody. They can apply. It shows on our website how they're able to. And on the other hand, we have from Prima Med Health, there are the clinical, the nursing side that's available. So we have here as our guest speaker for the day, it is a nurse that has come from our home health agency, where she can share about some of the nursing service that we provide. She has, it's back up as well. So with Jessica and Zelia, thank you, and we can help to introduce you all to come to present about home health service. So thank you once again.
Hello, my name is Jessica. I'm one of the nurses with Prima Med Home Health. My name is Zelia. I'm also one of the nurses with Prima Med Home Health. And today we're going to do some educating on blood pressure and blood sugar, and just give some key points for you guys to take home with you today. Why blood pressure is important, and to know about blood pressure, the impact that it has on your lives. It impacts vital organs like your heart, your kidneys, and your brain. Having blood pressure issues, they're all tied in with chronic disease, and they can cause strokes and diabetes. The learning objective for today is to understand the basics of blood pressure and blood sugar, to recognize normal versus abnormal levels, and identify the nursing roles in patient education. What is blood pressure? It's the force of blood against the artery walls, and that's measured as a systolic and diastolic number. Understanding how blood pressure functions, so basically your heart pumps blood, your arteries carry it throughout your body, and then that resistance sets a pressure on the blood pressure machine. So it's basically from your heart through the arteries, and then it circulates around and around and around. The normal ranges for blood pressure are 120 over 80, 120 being the top number, 80 being the bottom. An elevated reading would be anything between 120 to 129, and the bottom number being over 80. And then high blood sugars, high blood pressure, is over 130. So anything over 130 over 80 would be considered high. Understanding high blood pressure, there's chronic high blood pressure, and then primary versus secondary hypertension. So primary is usually caused by a sedentary lifestyle. Age and genetics also have a role in that. Versus secondary hypertension is usually caused to an underlying disease like kidney disease, sleep apnea, and hormonal imbalances. So symptoms and complications, frequently there are no symptoms to high blood pressure. And like I said earlier, it's associated with heart attack and stroke, and also it will damage your kidneys if you're having constant high blood pressure, because your kidneys have a lot of arteries, and if it's basically pumping, it'll mess with your arteries and your kidneys. So how to measure your blood pressure, ensure the correct size for your cup. There's adult cups, and then there's also adolescent cups for like the children. You want to keep your arm at heart level. You want to refrain from drinking coffee and stress if you can before taking your measurement. And then always cross your legs. You don't want to cross your legs or be talking when you're taking your blood pressure. And then factors influencing the blood pressure is your diet, stress, medications, and weight and smoking habits. So you want to maintain, you want to limit your salt if you are having high blood pressure issues. Stress, I know it's hard to say not to stress, but stress is a big issue for high blood pressure. And then if you're being non-compliant with your medication for blood pressure, that's also bad. And then obviously weight, you want to maintain a healthy weight and refrain from smoking, because smoking obviously would increase blood pressure. The nurse's role in blood pressure management, we instruct on the correct techniques to take blood pressure. We promote consistent monitoring. If you are having high blood pressure, we do give or educate on keeping a log and logging your day-to-day blood pressure to see where you're ranging from on a daily. And then we want to support healthy lifestyle habits. We recommend doing lifestyle changes. Follow the DASH diet, which is increasing fruits, vegetables, whole foods, poultry, fish, and then incorporate regular exercise. You want to focus on weight loss or maintaining a good weight, and then limit alcohol and smoking. Medications usually used for blood pressure management would be your ACE inhibitors. Those would be like the ones that end in like the prils, the medication lisinoprils, your angiotensin receptor blockers. Those are the ones that end in like the losartan, valsartans. Your diuretics would be like your furosemides,
Lasix, yeah.
And then your calcium channel blockers would be like amphetamine and
Those ones, yeah.
both of them. Mm-hmm. So monitoring and recording, we recommend maintaining, like I said earlier, blood pressure logs, taking blood pressure frequently, daily. You want to analyze your trends weekly and daily, and then we promote follow-up appointments with, if you're on home health, your nurses and your primary doctors. Patient education summary, the key steps for managing health: understanding your target blood pressure, you take your medications consistently, and then report any symptoms that you may be having, like chest pain, headaches, what else? Dizziness. And then now we're going to talk about blood sugar. What is blood sugar? It's basically glucose. Is the primary energy source for the body, and it's regulated by insulin. How to understand how the body regulates sugar. So insulin reduces your glucose levels, and the liver stores both and releases sugar. The normal ranges for blood sugar fasting blood sugar, if you were to check your blood sugar before you ate, would be from 70 to 99. Post meal, which is after you eat, would be less than 140, and your HbA1c should be below 5.7. What is diabetes? Types of diabetes. So type 1 diabetes are people that don't produce any insulin. And then type 2 diabetes would be insulin resistant. Prediabetes would be elevated blood sugars without an actual diagnosis. Causes and risk factors would be genetics, obesity, inactivity, and a poor diet. And then symptoms of blood sugar, that if you're having blood sugar issues, would be like an increased thirst, frequent urination, and fatigue, and blurred vision. Complications, it does damage the nerves, kidneys, and your eyes. And heart disease and infections are also related to blood sugar problem. The nurse's role in glucose management, we want to encourage monitoring levels, and we educate on both signs of high blood sugar and low blood sugar. And then we recommend doing lifestyle modifications. We would recommend a balanced diet, regular exercise, and weight control. Medication overview. Some of the things that they medicate for blood sugar would be insulin, metformin, sulfonylureas,
And GLP-1.
They're kind of hard to pronounce. Monitoring blood sugar. So there's finger sticks, and then if you prick your finger, and then you put it in a glucometer, and it'll read the reading for what your blood sugar is at. Managing hypoglycemia or hyperglycemia. If a patient or a person is experiencing low blood sugar, we recommend consuming carbohydrates. And if they're experiencing high blood sugar, we encourage, obviously, adhering to their insulin and proper hydration. Patient education summary, identifying the symptoms, monitor readings, and maintaining consistency. The relationship between blood pressure and blood sugar is that they both have an impact on cardiovascular and kidney health, and there's a connection to metabolic syndrome. So the key takeaway points that we want you guys to take with you today is to understand the metrics, the ranges, promote healthy lifestyle changes, and conduct a regular monitoring. Do you guys have any questions? So we're actually going to do a blood pressure reading today and a blood sugar demonstration on how we would check out on patients. So I'm going to take my blood pressure on this chair.
Okay, so I'm just going to go ahead and place the blood pressure cuff on her left arm. Go ahead and just wrap it on. Then I'll have her relax her arm. Her feet are uncrossed. And go ahead and just, and I'll just do your sugar too. Now on this little monitor, you just go ahead and press the little start button, and it kind of just does its thing. It's tracing. Did you consume any caffeine? Yeah.
Yeah.
They're really slow.
Once you go for the.
Mm-hmm. Yeah. Okay, so now her blood pressure is 160 over 119 or 116. It's pretty high. Yes,
I am a non-compliant patient. I had chocolate and
caffeine. So I'm so sorry. It's yeah, exactly. Sugar. And now we're gonna take her blood sugar.
And Starbucks.
And
Yeah.
Starbucks.
And chocolate.
And chocolate.
There you go.
Her blood sugar's not gonna be right.
Yeah, very good. Or do you want to do mine?
Sure, our engineer, we're good. And LVN, we're good. No, we're fine.
Alright. So with the finger sticks, these are, you primarily want to take the finger sticks on the middle and ring finger. Then you want to cleanse it with an alcohol wipe first. I'm going to grab my little glucometer, throw a little strip inside. What it looks like before you check it. That's a little prick. And you always want to do it on the outside of the finger, not on the actual finger pad. Squeeze till a little bit of blood comes out. Just raining blood everywhere. $121.
No, not bad. You're gonna make it.
And then just cleanse it and then apply pressure. That's pretty much it.
Any questions from the audience?
Good job, ladies. Thank you.
So there we have it. So we have seen here today the financial side of what options are available. For people that are living at home, there's money, resources available to help people to age in place where they're living at. If someone would benefit from having a nurse at home through home health service, it's a benefit that they're entitled to through their insurance. Nurses will visit, and then based on their plan of care, if it's to do certain teachings like how to be compliant, if they have diabetes or another type of health condition, or if it's with physical therapy, they have someone to help them to exercise to recuperate. So those are, I'd say, the two sides of the coin that we like to share about here today is the financial side with resources, and then through Prima Med Home Health, we have nurses that can visit people at home for free. So in summary, there are many resources available to help people regardless of income. It costs nothing out of pocket if it's to live in assisted living, if it is to get free food at home, utility assistance, nursing visits, all of those things are just a phone call away. Someone can apply for all of them at any time. All of these resources are listed on redwoodbakersfield.com, which is on our flyer here that everyone receives copy of. And just reach out anytime. And we are glad to help to apply for any of these programs that we've gone over. So if you all have any questions about the programs that we've gone over, if it's with applying for food or with housing, those necessities, just feel free to answer. I'm glad to answer any questions. We still have 18 minutes together, and we have some people that have attended here by video as well. So we'll see if there are the questions by video. With some people, oh, sure, go ahead.
So there are a couple of restrictions with the VA, and also some elderly people having Aetna. Would there be any resources for them?
Yes, she just asked a very pertinent question. People have what is called a managed Medicare plan. They have a managed Advantage plan. So instead of having straight Medicare, where someone can directly receive home health service, and the plan has to get prior authorization. Many of them, they have to be enrolled as a provider with Humana or United Healthcare, or if it's Kaiser Permanente or the VA, TriWest is a very common one. And yes, absolutely. So through their doctor, they can help to answer questions about, for example, if their doctor is contracted with this type of insurance, they could refer a home health agency to help take care of that person. And there are many services that help give, if it's to illuminate the way about what options are available with private insurance, and one of which is called HICAP. So HICAP is free. It's a government program. It is called Health Insurance Counseling and Advocacy, and they're in conjunction with the Department of Aging. This is a free benefit that can help people to navigate Medicare Advantage plans. Everyone sees the commercials on, it's the retired baseball player that wants you to sign up for an Advantage plan, on these on the daytime TV. What is the best option? What is best for someone in any given situation? There are free programs like HICAP that can help to provide clarity. So that is the way.
There's a question answered.
Yes, absolutely. Yes.
What about the deaf? So I live on a block who, like, the majority are seniors, and 6 of them are over 85% deaf, and they don't qualify for anything through their insurance.
There's a certain, I'll show here on screen. It's under people with disabilities. The Independent Living Center, they have, for people that are blind or deaf, there are certain resources, and that would be one of the first starting points we would recommend. And they also have the, there's a certain program through them. I would say the starting point would be Independent Living Center for anyone that's deaf, and it's free. Someone can come out to talk with them from this program. They help with its interpreting service. Deaf and hard of hearing services provide American Sign Language interpreting service to facilitate communication between deaf and local business and organization. So it's, they have an office, I believe it's on Truxton Avenue, but it shows here on this website, I'd say that's the starting point. We still have our pizza. We have our first taker. Now, after the blood pressure reading, you all took the fun out of eating the pizza. We should have ate pizza before we heard about the recommended diet from the nurses. But that's okay. If it's just once a week, it's our meal we can splurge.
I found them. You can have all of your food groups on a pizza.
Sure.
All the
So
food.
there it's healthy.
You say so. I'll listen to the first nurse. 'Cause I like nursing. But very good.
Actually, my dietitian told me that when I learned that in college, she said if somebody has to eat something, the best, like a fast food, the best one would be like a, is it like a combination pizza? Because it has vegetables, it has your cheese, it has your meats.
Now don't